Leontiasis Ossea Secondary to Uncontrolled Hyperparathyroidism in a patient with ESRD, also known as big head disease, a consequence of untreated secondary hyperparathyroidism, is believed to be caused by elevated levels of fibroblast growth factor 23, as well as other growth factors and cytokines due to elevated parathyroid hormone excess. This report depicts a 28-year-old African American woman with Leontiasis Ossea, secondary to hyperparathyroidism from ESRD or End-stage Renal Disease. This unique complication illustrates the consequences of untreated hyperparathyroidism. This report characterizes a patient with medication and dialysis noncompliance. The patient noticed that throughout the first year of being diagnosed with ESRD, some changes began taking place of her facial, maxillary, and mandibular bones. The purpose of this report is to understand, identify, and manage this rare consequence of hyperparathyroidism. Case presentation. A 28-year-old female presents with a case of anemia of chronic disease secondary to idiopathic end-stage renal disease. She has no prior medical history and takes no medications. She describes a rapid onset of severe lethargy, dyspnea, and weakness over approximately 2 years, in which she was diagnosed with idiopathic renal failure. The patient was advised to begin treatment with cinacalcet, vitamin D, and sevelamer. However, she was non-compliant. She then began to notice pain in her joints and altered facial structure appearance. She experienced generalized weakness and lethargy and described a rapid growth of her mandible and maxilla and gaping of the mandibular teeth. The patient was diagnosed with secondary hyperparathyroidism, secondary to ESRD, with Leontiasis Ossea due to elevated PTH, as well as brown tumors, known as osteitis fibrosa cystica on X-ray imaging. The treatment plan was parathyroidectomy for resolution of the hyperparathyroidism. The results of treatment with parathyroidectomy resulted in resolution of the hyperparathyroidism as well as gradual improvement of the Leontiasis Ossea. The results of reduction are seen here. Over the first year, you can see the borders dramatically sharpened on the bilateral lateral borders of the face. These demarcations are happening prior to the parathyroidectomy. In the second image, this is 6 months post-parathyroidectomy, where the borders of the face have now gradually declined and there's not a sharp ridge at the inferior wall. The third image is 1 year post-parathyroidectomy, where you can see significant reduction in Leontiasis Ossea and decreased maxillary and mandibular bone angles. On physical exam, there is significantly enlarged mandibular and maxillary bones with spreading of the lower teeth and gingiva, as well as gingival hyperplasia prior to treatment. Leontiasis Ossea is not only found in humans. However, there's been cases seen in horses that have untreated hyperparathyroidism as well. In conclusion, based on this case report, it is concluded that one with secondary hyperparathyroidism may be worked up and educated on the side effect of Leontiasis Ossea. This case report is unique in that it represents a rare consequence of a disease, as well as this explained pathophysiology. When one identifies one with a similar disease presentation, with the assistance of evidence-based medicine and the combination of both medical and surgical interventions proven to revert the facial bone defects caused by this excess growth factors. One may also take away the importance of proper patient compliance with medical management to prevent adverse events.